Assalamu alaikum. This is Asif Ali Bhatti, and I am speaking to you on the behalf of my Pakistan US Friends Forum. Today, we are discussing again the health affairs. I mean to say, the very important segment of the SGDs, which reflects the take care of the health around the world, especially the developing countries. So, we are talking about the issues which are having a different diseases which are in the developing countries. So today we are talking about the eye issues the people of Pakistan are facing. And with us today, a very famous scientist of Pakistan, Dr. Baig, and his portfolio, if I tell you that he has done his PhD in human genetics under Dr. Muhammad Iqbal at the Islamia University of Bahawalpur. Then Dr. Ansar, and later at the Harvard Medical School. And then today he is the doctor in the lab of the Dr. Barrow at UC San Diego, and he's one of the pioneering research on the retinal organados, tiny model of the human retina that allows scientists to study eye diseases and test breakthrough treatment like gene therapy, and the regenerate the medicine. So the Dr. Hafiz is right now working in the UCSD and the Shiley Eye Institute. He is working on the human eye. He's a scientist. He's the only Pakistani who is working on this huge project. I welcome Dr. Hafiz Beg.
Thanks a lot, Bhatti Saab. It's always a pleasure to talk to you, and thanks for the
Yeah.
nice introduction.
It's a great pleasure to have you today in our show. So, we are talking about the different diseases, and we are also talking about the experts. Those are specialized in their medical domains. So, what is your domain exactly, which I just narrated about your career and about your specialization, but what you are doing right now?
I'm basically a clinical geneticist. So I started my career as a geneticist, and my focus was to find out the underlying genetic causes of vision impairment in the population of Pakistan, especially the underdeveloped regions of Pakistan like southern Punjab. That was the place where I started my scientific journey. And that journey continued all over the world. I worked in different famous labs, very well developed labs in the world, especially in Switzerland. Then moved to Harvard, and currently I'm moving towards the treatment strategies to solve those issues which I identified not only during my own research, but which are currently the hot topics in the area of medical genetics, and more specifically in the area of vision impairment. So, my whole target is to develop the treatments for those visual impairments which are untreatable right now.
Okay, Doctor, we usually see in our societies that we do not pay attention towards the eye problems, eye-related issues, medical issues especially. We always pave the way and pay attention towards the heart diseases, brain diseases, and the cancer-like situations are the medical situations. So, how do you see that? How much it is important that we should pay attention towards eye medical issues?
This is important. I mean, especially in context of Pakistani population, it's even more important because in Pakistani population we have the practice of cousin marriages, and Pakistan is considered as one of the hot spots to study genetic disorders. And as you mentioned, like vision impairment, it is not the primarily hot issue in the even in the modern world of medicine. So people, they pay attention to heart diseases, to brain disorders, to cancer and all those issues. But the burden, the impact of the vision impairment on an individual's life, on the life of their families, and overall on the socio-economic status of the country is very important. We are not paying that much attention, which we were supposed to pay, But nowadays, people they are working on it. They are trying to find out the genetic causes because we see, yeah, eye disorder. We take it, okay, this is simply eye disorder. But just think about those people who are without eyes. They can't see. They even don't imagine how beautiful the world is. So I believe it is one of the most important blessings from the nature, from the Almighty, that we can see and we visualize the things. So just think about ourselves, for example. If somehow we lose our vision, how will we see the world? It's simply dark. It's simply just like night all over the time. So it is important. And now, yeah, from the last couple of years, people they are trying to pay attention and they're trying to address those issues which were under addressed during the last maybe I believe like 50 years. So yeah, people are paying attention on it now.
So the reason behind this attention is that the retina issue are the other problems which are we usually see that it comes from your mind, or there is some other issues which actually create causes of eye diseases.
Yeah, there are many. There are many. But majorly, we know three major conditions. Uh, One is glaucoma, and commonly in Pakistan, in Urdu language, we call it as kala motia. And then there is another which is cataract. We call it as sufad motia. And then the retinal issues. But the issue with the glaucoma, cataract, and retinal diseases is retinal diseases are incurable. You
Oh.
can do anything. If once that disease start, you can't do anything. With the cataract, we do it every day. For example, maybe like our almost all of our elders they have those lens replacements आंख में लेंस डलवा लें and like for the glaucoma for the kalamotia people they also develop certain treatments जिसमें आंख से इंजेक्शन निकाल के पानी थोड़ा सा निकाल के तो प्रेशर रिड्यूस करते हैं which ultimately helps in the improvement of your vision but in case of retinal diseases this is the worst thing. Worst in a sense, once that retina degenerates, you can't do anything. Currently there is no treatment available for these kind of retinal diseases. So out of the big three issues, retinal diseases, they are kind of like most enigmatic. They are most interested in terms like we don't know what is going on.
Before this, I will go to your expertise and whatever you are doing right now in the lab. I would be happy to tell you that unfortunately, journalists, we are the people in Pakistan, especially, we usually pay attention towards the big issues related with the health affairs of the common people. But we don't have even expertise, and you have seen that the many journalists are just talking about the medical issues as per the doctor's prescriptions, you may call it, the doctor's directions, which they are telling them, and they are believing in that. But I'm little bit doing different job at this level when I have completed my journey of 27 years as a journalist and as a professor in different universities. I have acumen that the people those are facing this kind of a very strange disease in Pakistan. You are the one who is actually drawing the picture and also paying attention towards the real cause, which is creating this blindness in Pakistan. And you are very rightly said कि अल्लाह ताला ने हमें जो आंख का तोहफा दिया है वो किसी भी और तोहफे से कम नहीं बल्कि सबसे कहीं ज्यादा अहमियत का हामिल है कि हम देखने की सलाहियत से अगर महरूम हो जाएं तो दुनिया अंधेर हो जाती है। तो मैं इसी इशू को आपसे जो आपकी रिसर्च है मैं उसमें पूछना चाहूंगा इस वक्त पाकिस्तान में क्या तादाद होगी हमारे यहाँ जो मुकम्मल नाबीना अफराद हैं और जो पार्शली ब्लाइंड हैं किसी भी वजह से देख नहीं पाते हैं या कम देख पाते
Very important question. And yes, you're right. We don't pay attention to these kind of diseases. And I always face difficulty when I try to educate people. For
हैं।
me,
That's why we are
sometimes it's
providing you this
impossible.
platform, Dr. Hafiz, we are really delighted to give you this platform, and we want to sensitize people actually. Yes, please go ahead.
I love to. I love to. I mean, this is like kind of one goal when I started my journey. That was the thing when I saw people around me, they were having difficulties, they have inborn errors, and even like with those errors, with those diseases, they were thinking it's not a disease, it's just something natural. We were born with this, and we know there is no cure, and all those things. I always face difficulty to educate people. And it's a big game. Honestly, it's a big game. And I wish journalists like you who know the world, basically you guys who have this exposure, who have that experience, you guys can see the world in a different way. Unfortunate again, but fortunate on the other sense. Unfortunate in terms that people who are working like in the field of journalism in Pakistan, for them, this is not an issue. Honestly, I have never seen this kind of debate in Pakistan. To the best of my knowledge, there is not even one single debate in the national media for the awareness of these genetic disorders, not even one. So I'm happy that at least someone he's he feels and he understands, he knows like this is one of the prime topic. It's not the thing which we should not address. So this is very important, one. And second, in terms of the numbers, Pakistan, as I mentioned, is one of the hot spot.
Oh my
If you
God.
see the
Mhm,
map from
mhm.
the WHO, you would be surprised. Almost, if I say randomly, I believe it's like 2015 data, if I remember correctly, more than 1 million at that time. They were like enrolled. This is the issue. Like, what is the actual number? We don't know because
Mhm.
people, they don't pay attention. They don't consider this as a disease. So we don't know the actual number. But I can like tell you with my experience and the work which I'm doing to identify the genetic causes of the vision impairment in the southern Punjab, I'm like surprised in my own database, in my own experience from that small portion. If you compare like Pakistan, that southern Punjab, although it's a like big region, but it's less populated. You have desert and not like big metropolitan area. So even with that, we have identified approximately more than 5,000 patients. So it's a big number. And like this is these are those people who are not enrolled anywhere. So they are like the real patients.
So
And
you are talking
unfortunately,
about the blind people? Are you talking about the partial?
I'm talking about the specifically the retinal disease people. It's a very big number. It's not a small number. When I say big number, we call them as rare diseases. So in rare diseases, even with this 5,000 number and just within 10 years, not with that much screening, if we are getting this number, it means the situation is way more worse than we expect. And the other worst thing is, I would say it's 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 like very bad that we don't have even facility to screen those people. Like even in my area, we don't have those instruments with which we can check. We can check what is the status of their disease, when did the disease start, and how the disease is progressing. We don't have that facility even. So this is just with our work. I'm working with Dr. Iqbal, like he is the eminent scientist from the southern Punjab. And we're working a lot. We are trying to educate people. We are trying to convince them this is a disease. You need to screen yourself. You need to screen your kids. And please be aware of this condition. This is genetic. It may transmit from you to your kids, from your kids to their kids, and then like so on. So a lot of work is needed in this prospect to identify the actual prevalence, the actual number.
Dr. Saab, we are just happy to make our cricket teams, blind teams, or the hockey teams, or some of the other specialized form of the games. But unfortunately, as you just mentioned, we are not paying attention towards the real cause of that partial or the complete blindness. So this is a fortunate time that you are working on that, and especially while having great opportunity in United States and one of the best institute, UCSD, you are working over there. So in my view, you just mentioned we were talking about these issues, and we were discussing because you are the board member of our advisory in our think tank. So we were talking about the heart stroke, brain stroke, but you mentioned today it is also eye stroke.
Eye stroke. Yeah.
So it's
Yeah.
really unfamiliar for me, but at least as a journalist and long journey as a journalist. So how you will define that? It is so serious issue.
You know, if like just for the common thing, all of our body needs blood supply.
Okay.
Whenever there is any issue and that's in that supply, that part of your body will be deficient of oxygen, as a result of which that part of your body will start dying. So this can happen anywhere. This can happen in your heart. This can happen in your brain. And we know about brain stroke a lot. Oh, falaj ho gaya. Oh, blood supply to the brain stop. Same can happen to eye as well.
Oh,
And if there is a
are you talking
blockage,
about the blood clots?
yeah, in general, it's blood clot. So if there is any clot in in the main vein of your retina, then the blood supply to the retina will stop.
Oh,
And retina is one of the most sensitive part of your eye. So eye is a complex structure. This is something which you see from outside, but there is something which is behind,
and
which
there
is
is a whole
processing
mechanism.
all that
Yeah.
information. Yeah. So that retina is basically the part which you don't see from the naked eye with the naked eye. So that retina, if it doesn't get blood supply, its cells start dying, and it's a worse situation. Although with the passage, like there are different causes, that blood supply can be progressive. For example, the clot, it starts accumulating with the passage of time, maybe, like months, maybe years. That's why it is a phenomena of aged people as well. But if that clot, it comes suddenly, it stops the supply, blood supply to your retina. And
Oh,
then your retina, it starts dying, which may result in the complete blindness
oh my
if you
God.
are not treating it.
आपने मुझे एक मिसाल भी दी थी कि आपके एक जानने वाले थे जो नौजवान थे और एट द एज ऑफ 30 प्लस ही गॉट सम काइंड ऑफ ब्लड ब्लॉकेज, जैसे आपने मेंशन किया कि क्लॉट की वजह से, और उनको ही लॉस्ट हिज लेग.
Yeah. So the thing is, like, if we see clotting, this is the outcome. The actual thing is, what is this? Where is it coming from? If your blood, it has that kind of mechanism where it can start clotting. That clot can be anywhere in your body. It may be in your brain. It may be in your leg. It may be in your heart. So, it depends upon in which part of the body that clot goes. And wherever that clot will go, it will stop the supply of the blood to that part of the body. And who knows, if it is brain, it's brain stroke. If it's heart, heart attack. So this is very important to identify the underlying cause. What is this clotting? Where is it coming from? What is the cause of this clot? So we need to address. It doesn't mean like if you see clot in your eye, it's just the outcome. But what is going on in your body, we don't know. So it's a very, very serious issue.
इसका मतलब ये है कि आंख के अंदर जो हम अक्सर देखते हैं, अगर मैं सिर्फ आइडेंटिफाई करने की कोशिश करूं या समझने की कोशिश करूं, तो जो सुर्ख कलर के हमें नुक्ते नजर आते हैं या कोई बड़ा सुर्ख कलर का हमें कोई साइन नजर आता है हमारे वाइट एरिया के अंदर आंख के, तो दैट इज द इंडिकेशन, आर यू सेइंग?
ऐसा हो सकता है,
वन
ऐसा
ऑफ द
हो
साइन
सकता है, बिकॉज इट डिपेंड्स अपॉन ये प्रोसेस ओरिजिनली इट स्टार्ट्स इन द बैकग्राउंड।
इन द बैकग्राउंड, या।
तो ये ऐसा नहीं है कि हम आंख में आपको ब्लड या कुछ इस तरह इमीडिएट नजर, यस, अगर सिचुएशन वर्स्ट हो जाए, दिस इज पॉसिबल दैट यू सी ब्लड इन द वाइट पार्ट ऑफ योर आई। It's possible, but in general, this is in the retina behind the eye. So that's why all those treatments are for that part of the eye. But again, it depends. When are you gonna address the issue? If you address the issue at the right time, you are lucky enough, your issue got recognized, your issue got identified, yeah, you can go with the treatment. But if it's already like, it's very severe and you already have lost maybe like more than 50% of your vision, then you are not gonna recover it. So
ओ माय
that's why
गॉड।
we call it, it's incurable if it is that extent.
अगर हम अपने पाकिस्तान के सुनने वालों को, जो कि बड़ी तादाद में हमें सुनते हैं, अगर हम ये कहें कि ये जो बीमारी है आंख की, ये उतनी ही सवेयर है जो एक क्लॉटिंग की वजह से, ब्लड क्लॉट की वजह से हार्ट अटैक का बायस बनती है, ब्रेन हेमरेज का बायस बनती है, इसी तरह से ये आंख खत्म करने का भी मौजब बन सकती है।
बिल्कुल, बिल्कुल, आप you are absolutely right. This is what it is. This is what it is.
और
Yeah,
आपके
it's
ख्याल में
actually
और
actually the
आपके
exact mechanism.
और आपके ख्याल में इसका जो बैकग्राउंड है या इसकी जो रियल काज है, उसका जब तक मालूम नहीं किया जाएगा, हम अब बाहर से क्योर करने की, जैसे कि आपको जख्म लग गया हाथ के ऊपर और वो ठीक नहीं हो रहा, तो दैट मीन्स कि आपको चेक करवाना चाहिए कि आखिर क्या वजह है कि ये जख्म क्यों नहीं ठीक हो रहा। तो यहां पे भी
Exactly ऐसे
सवाल
ही।
यही है कि अगर आंख तेजी के साथ लूज करी अपने विजन को, तो उसका फौरन टेस्ट करवाना चाहिए, चेकअप करवाना चाहिए, और उसकी जो क्लॉटिंग की खास तौर पे रीजन है कि वो किस तरह से आपके बॉडी पार्ट्स को डैमेज करिए, इंक्लूडिंग योर आई। क्या ऐसा ही है?
बिल्कुल ऐसे, you are absolutely right. You are absolutely right. Yeah,
ओके।
this is what it is. So
अच्छा।
whenever there is retinal blockage, the first question is, where is this coming from? So
ओके।
this is primary. This is primary. Like you need to identify the root cause, and then you have to address that cause.
अच्छा, एक चीज और बताइएगा हमें कि आपने कहा कि पाकिस्तान में जो कजन मैरिजेस हैं, दैट इज वन ऑफ द बेसिक रीजन जिसमें हमारे लोग जो हैं वो अपनी आंख खो बैठते हैं या आंखों की बीमारी में मुब्तला होते हैं। तो इसकी जो अवेयरनेस है वो किस हद तक है? अभी हमने देखा है कि लोगों के अंदर ये शऊर थोड़ा सा पैदा हुआ है, लेकिन उस तरह से हमारी पॉपुलेशन 25 करोड़ की है, तो क्या वाकई लोगों के अंदर ये बात अब उन्हें समझ आ गई है या आने वाली है कि ये जो एक बेसिक काज बनती है, आपने कहा कि ये एक बहुत बड़ी वजह है, तो इसको अवॉइड करने के लिए कोई अवेयरनेस चल रही है या चलानी चाहिए?
पाकिस्तान कजन मैरिजेस ये सिर्फ एक आई डिजीज से काज नहीं करती।
जी हाँ।
There are many other issues. I know you guys, journalists, you did a great job to build that awareness for thalassemia.
यस।
And in Pakistan, like at the government level, even they are trying to promote that thalassemia screening program for the young people. And they are basically trying to convince you that if you are cousins and you are planning to go for marriage, please do that thalassemia screening before marriage, and it will tell you about your risk factors, that what are the chances, what are the percentages of developing thalassemia like diseases if you cousins are going to marry.
ओके।
And as I mentioned, cousin marriage is not causing only eye disease. There are many other diseases, intellectual disability, deafness, vision impairment, and many more. The thing that awareness regarding the cousin marriages, unfortunately, this is not up to the mark. I believe for these kind of diseases, we need to establish a program where we must do integrated disease management. We must try to involve all the members of the society, as we
Hmm.
just do for the polio campaign, For the polio campaign, there is always like media campaign. You see all those advertisement on the TV channels. Then you see all those awareness programs at the community level. So I believe for these kind of diseases, we need to establish that kind of program at national level.
Oh, great.
It will
Great.
take time. It will take time. It's not something which is just like we can do it by a click. It will take time, but we need to start it from somewhere.
Okay.
But
Yep.
honestly, to address these issues, we need to launch that level. We need to launch campaign at that level, like national level, to show the importance of the screening, especially for the diseases which are related to cousin marriages. So, nutshell, unfortunate, we are not there yet. And the other unfortunate thing is, even we are not trying to do it.
This is the unfortunate part.
So this is the worst. Yeah, this is the worst part. And I mean, I'm already working on these kind of
मैं
projects,
उसी तरफ ही आ
and
रहा
I
हूँ।
always try to.
मैं उसी तरफ आना चाह रहा हूँ। थैंक यू सो वेरी मच फॉर योर जेनरस जेनोसिटी टू अप्रिशिएट। ये बताइएगा कि आपने जो ये मिशन शुरू किया, ये इसके पीछे फंडामेंटली क्या अप्रोच थी? क्योंकि सारे लोग यहाँ पे हार्ट स्पेशलिस्ट बनना चाहते हैं, कैंसर के डिजीज के खात्मे के लिए अपनी एक्सपर्टीज लेना चाहते हैं, मुख्तलिफ दिमागी अमराज के लिए काम करते हैं, या इंसान के जितने बॉडी दीगर बॉडी पार्ट्स हैं उनके लिए वो स्पेशलाइज करते हैं। आपको कैसे ख्याल आया डॉक्टर साहब? एक तो ये बताइएगा। दूसरा, अभी जो आप काम कर रहे हैं, हमारे लोग इंटरेस्टेड होंगे, इसीलिए मैंने ये लास्ट में रखा ताकि लोग पूरी तरह से पहले बात को समझें। जैसे हमारे यहाँ एक होता है ट्रिकल डाउन इफेक्ट, कि आपको एंटी पिरामिड स्टाइल में पूछना चाहिए सवाल को हमेशा, कि आप तमाम उन पहलुओं को जान के उसके बाद फिर जो है आप सच्चाई की तरफ आए कि आप क्या कर रहे हैं, आपको ख्याल कैसे आया, और आपने ये चूज करने के बाद, यानी ये फील्ड चूज करने के बाद, इस पे अब तक क्या किया है।
डॉक्टर साहब मेरे I will go in the Urdu because this part is
जी, मैं
specifically for
चाहता
my
हूं कि हमारे लोगों को, जब आप पाकिस्तान में इसको नशर करेंगे और हमारे दोस्त देखेंगे इसको, हमारे पाकिस्तानी देखेंगे, दुनिया भर में देखेंगे, इंडिया में देखा जाएगा और बाकी पार्ट स्पेशली मिडिल ईस्ट में, तो उनको इस बात की समझ आएगी कि ये कितना इंपॉर्टेंट है और आपने इतना बड़ा डिसीजन कैसे लिया है। आपको कैसे अंदाजा हुआ कि ये भी एक बहुत बड़ी बीमारी है जो कि हम लोग सब मुब्तला हो रहे हैं इसमें।
डॉक्टर साहब मेरी जर्नी जो है, आई वॉज बॉर्न इन अ विलेज इन रहीमर खान, सो कोट समाबाद छोटा सा एक गांव था जहां पैदा हुआ। एंड देन ऑल ऑफ माय एजुकेशन इज फ्रॉम बहावलपुर, अ सिटी which is known as city of palaces, city of schools। एजुकेशन भी सारे वहां से अनफॉर्चुनेट है, सिटी ऑफ पैलेसेस है, सिटी ऑफ स्कूल्स है, लेकिन अंडर डेवलप्ड है। सो रिसर्च के लिए जब इस फील्ड में आया तो ये कंप्लीटली मेरी पर्सनल ऑब्जर्वेशन थी कि हमारे यहाँ उस इलाके में खास तौर पर बच्चे जो हैं वो पैदाइशी माजूर बहुत ज्यादा हैं। कोई पैदाइशी गूंगा बहरा है, कोई पैदाइशी दिमागी मरीज है, कोई पैदाइशी नाबीना है। तो ये एक ऑब्जर्वेशन थी। और फिर वो कहते हैं कि अल्लाह रब्बुल इज्जत भी बरकत डाल देते हैं। तो लकी रहा कि डॉक्टर इकबाल जैसे प्रोफेसर मिल गए, और बस फिर तो मालूम हुआ कि शायद अपनी साइंटिफिक फील्ड का मकसद ही यही था। तो उनके साथ मिलके मेंटोर, मेरे प्रोफेसर भी, मेरे मेंटोर भी, तो उनके साथ मिलके हमने ये पूरा प्रोजेक्ट लॉन्च किया कि हम साउदर्न पंजाब की पॉपुलेशन को स्क्रीन करते हैं और देखते हैं कि इसमें कौन कौन सी डिजीजेस कॉमन हैं। और देखते हैं कि कोई कॉमन काज हमें मिले तो हम उसको एड्रेस अगर किसी तरह कर सकें। तो यहाँ से जर्नी स्टार्ट हुई और फिर सफर मुझे ले गया स्विट्जरलैंड में। एक लंबे दरमियान में चीजें रहीं और फिर मैं वहां पे डॉक्टर अंसार की लैब में युलगोन आई हॉस्पिटल यूनिवर्सिटी ऑफ लौजान में पहुंच गया। तो डॉक्टर साहब भी विजनरी आदमी और पाकिस्तान के लिए दर्द दिल रखने वाले। तो हमने वहां पे फिर मिलके एक बहुत बड़ा प्रोजेक्ट लॉन्च किया जिसमें हमने पाकिस्तान में साउदर्न पंजाब से नहीं बल्कि पूरे पाकिस्तान से हमने सोचा कि हम फैमिलीज आइडेंटिफाई करें, उनकी स्क्रीनिंग करें। और इस सारे काम के लिए हम खुद जाते हैं फैमिलीज के पास, उन्हें कन्विंस करने की कोशिश करते हैं कि ये आपके लिए है। हम उनसे 1 रुपया भी नहीं लेते। और ये जो हम जो जेनेटिक स्क्रीनिंग करते हैं, अगर मैं पर सैंपल इसकी कॉस्ट लूं तो तकरीबन 1 लाख रुपए से ऊपर पड़ती है सिर्फ इनिशियल स्क्रीनिंग की। और अगर हमें एक फैमिली में 10 भी ऐसे लोग मिल जाएं तो हम 10 के 10 की स्क्रीनिंग करवाते हैं।
माशाल्लाह।
बहुत अच्छा काम था। बहुत, अब तो 10 साल हो गए करते हुए, डॉक्टर इकबाल, डॉक्टर अंसर उनके साथ मिलके। और फिर मैं जब हार्वर्ड में आया तो वहां पे मेरा गोल टोटली डिफरेंट था। क्योंकि हार्वर्ड ऑलवेज वर्ल्ड नंबर वन, एंड आई एम प्राउड टू बी द ओनली पाकिस्तानी इन द हिस्ट्री ऑफ ऑक्यूलर जीनोमिक्स इंस्टीट्यूट जो कि वहां पे रेटिनल ऑर्गेनाइड्स पे काम कर रहा था। और ये भी एक नई टर्मिनोलॉजी है, रेटिनल ऑर्गेनाइड्स। मेरी जो एक्सपर्टीज है वो ये है कि मैं जो रेटिना, मैं अभी से रेटिना रेटिना बात कर रहा था बार बार, ब्रेन का पीछे वाला हिस्सा, मेरी एक्सपर्टीज है कि मैं उनको डिश में डेवलप करता हूँ। सो मैं आपके स्किन स्किन का पैच लेके उससे मैं रेटिना बनाता हूँ, ये मेरी स्पेशलिटी है। और ये इतना बड़ा प्रोजेक्ट है, इतना बड़ा काम है कि हम हमारे लिए पॉसिबल नहीं है कि हम हर पेशेंट का रेटिना लें और फिर स्टडी करें कि क्या हो रहा है। तो जब मैं ये प्लेट में बना लेता हूं तो अब मेरे पास एक मॉडल आ गया और मैं इस मॉडल को यूज करता हूं पॉसिबल ट्रीटमेंट स्ट्रेटजीज को डेवलप करने के लिए। दो मेरे मेजर गोल हैं जो मैं इस रेटिना को प्लेट में डेवलप करता हूं
क्विकली
इस
बताइए
थ्री डी
कितना टाइम
स्ट्रक्चर।
लगता है एक आई के बनने में, आपका तजर्बा।
डॉक्टर साहब, ये बहुत इंटरेस्टिंग क्वेश्चन है, आई ऑलवेज लव
क्योंकि
टू
हमारे पास
आंसर दिस
टाइम जरा
क्वेश्चन।
शॉर्ट है, मैं चाहता हूं कि लोगों की क्यूरियोसिटी
टू
जो है ना
एटी
वो आप
डेज
उसको समझें।
पूरा 1 साल, जिस तरह
बच्चा,
डेवलपमेंट
बच्चे की
बच्चा
पैदाइश।
बच्चे की होती है, बिल्कुल हो सही, उसी तरह ही 280 दिन लगते हैं हमें मॉडल तैयार करने में। फिर हम उस पर एक्सपेरिमेंट करते हैं। और मुझे यकीन है कि अगर मैं इस पे बात करूंगा तो फिर तो हमें एक कंप्लीट
हाँ,
इंडिपेंडेंट
we will
सेशन
talk
करना
in
पड़ेगा।
detail on this subject because you are the only expert who can describe very well. I believe so.
वुड लव टू, वुड लव टू, ऑलवेज।
तो आप इसको अभी जो आपके इरादे हैं, आप एक आई बैंक बनाना चाह रहे हैं, वो भी क्विकली बता दीजिएगा। फिर उसके बाद हम यूएन का जो मिशन है उसके ऊपर हम बात करेंगे कि कैसे हाउ यू अलाइन विद अस एंड हाउ वी कैन मूव फॉरवर्ड।
लाइक सर, दिस इज, आई विश, लाइक एज आई मेंशन, पाकिस्तान में तो बहुत वर्स्ट सिचुएशन है। So I wish I could ever develop a retina bank in Pakistan. So आपने ब्लड बैंक का सुना होगा, किसी इमरजेंसी के केस में ओ पॉजिटिव चाहिए, ए पॉजिटिव चाहिए, बी पॉजिटिव चाहिए, यू गाइस जस्ट गो टू द ब्लड बैंक एंड गेट योर पेड। May I wish I could develop similar kind of system in my own country in Pakistan, जहां अल्लाह ना करे कोई भी शख्स जो इस डिजीज से अफेक्टेड हो वो अपनी बिनाई को वापस हासिल कर सके।
अंधेरों में
मैं
चला
ये
जाए
कहना
और
चाह रहा हूँ कि ये ब्लाइंड हो गए हैं, मैं उनके लिए ये रेटिना बैंक, दैट विल बी अ काइंड ऑफ ब्लेसिंग, एंड दिस इज लाइक माय ड्रीम।
ओके सो
आई एम प्रीटी श्योर ड्रीम्स ऑलवेज कम ट्रू।
yes, Almighty is very gracious. When people think positively and go on the positive track, He always bless you the success. I believe so. So, United Nation के जो SGDs हैं, which are also covering these health issues, especially in developing countries like Pakistan, आप कैसे अप्रिशिएट करेंगे कि हमने जो इनिशिएटिव लिया है यूनाइटेड नेशन के SGDs पर अमल दरामद के जरिए लोगों की मदद करने का, और आप उस बोर्ड का हिस्सा भी हैं? How you will comment on that, and then I will close the program.
डॉक्टर साहब, वी हैड लॉन्ग डिस्कशन ऑन दैट। And I appreciate the way you started, honestly. The passion, the way, and your plan. It's perfect. यूएन डेफिनेटली हम जब उनके साथ काम करेंगे और ये वन ऑफ द इश्यूज है जो एड्रेसेबल है, स्पेशली किड्स में, स्पेशली कुछ तो वो हैं जो ऑलरेडी हो चुका है, कुछ वो हैं जो इनकमिंग हैं। तो उनके लिए तो यकीनन ये बहुत बड़ा हमारे लिए सपोर्ट है। और
इंशाल्लाह।
हमारा हमारा प्लान भी यही है कि एट द एंड ऑफ द डे विद द हेल्प ऑफ यूएन डीपी और हम उनके जितने भी प्रोग्राम्स से हम इस्तेफादा कर सकें कि हम पाकिस्तानी पॉपुलेशन में उन इश्यूज को एड्रेस कर सकें और देख सकें कि
Thank you so much,
हम
Dr.
किस
Saab.
किस support कर
We
सकते हैं।
have a wonderful discussion with Dr. Baig, and we hope that we will continue this discussion on the health affairs. Thank you very much for watching me and Dr. Baig, and thank you for all our audience. See you next time. Till then, Allah Hafiz.
अल्लाह हाफिज, अस्सलाम वालेकुम
Walaikum
वरहमतुल्लाहि
assalam.
वबरकातुहू। थैंक यू भट्टी साहब।
Thank you, sir.